In addition to COVID-19, there was a deadly epidemic, I should say, claiming lives in 2020. And we're talking about opioid overdoses.
Yeah, the CDC says a record 93,000 people overdosed in 2020. That's 21,000 more deaths than in 2019. And the culprit here is not prescription painkillers. Instead, it's the opioid fentanyl.
Yeah, joining us now to break all of this down, who was impacted the most and how this plays out in our community, is a doctor on the front lines of this addiction, Dr. Lawrence Brown, the CEO of START Treatment and Recovery Centers in Brooklyn. Good morning, doctor. Thank you for being with us.
Good morning, and thank you for having us to be able to have this conversation on behalf of 2,900 patients that we provide care, about 75 adolescents, by dedicated 280 staff. Thank you so much for continuing to shine a spotlight on this issue.
Well, and that's just a snapshot at your facility and not the big picture as a whole, because those numbers are dramatically increased from there. So I want to ask you, what changed during the pandemic that caused these numbers to skyrocket?
I think we have to look at not only fentanyl, but also the fact that addiction and substance use are really driven by a number of factors, both environmental as well as issues around genetics. So with respect to the COVID pandemic, it had an economic hit on many communities of color. And when you have depression, when you have, in fact, issues that deal with mental health disorders, there is greater likelihood that we're going to see that type of uptick. Plus, it's important to realize that the providers that were extending this care were providers that now had to change the ways in which they provided the care in order to reduce the transmission of COVID. That meant more social distancing, but the social distancing then had a negative consequence of having less group therapy.
Absolutely. And Dr. Brown, obviously the pandemic only emphasizing the disparities right in those demographics. So we look at the states here. Can you break down which states registered the most overdoses during the pandemic?
I think we have to be mindful of the fact that while these numbers certainly would suggest that, but there are different factors in different states. The reason why I say that is that the fentanyl, for example, its availability is, while it's more widespread now than it had been 10 years ago, but the fact of the matter is that there are differences from state to state. And while in New York State is less than, say, the state of California, we need to realize that New York State is not out of the woods. There are different factors that drive its addiction versus what happens in California or the state of Vermont that clearly has a greater number, just looking at the numbers.
So when we talk about those who are addicted, is there a specific demographic that is most impacted from opioid overdoses?
I think that in that case, one has to realize when we say the demographics, we have to look at what's happening down under the hood, what's happening on the ground. So when we see, for example, prescription opiates, as it happened more often previously in communities that were well off, who had access to the medication. But then that evolved over time to the fact that use of heroin, because states then put together policies to reduce the access to those prescription opiates. But then based on the fact about what happens when you use heroin, when heroin is then combined with fentanyl, or drugs such as cocaine is combined with fentanyl, we then see an uptick based on what's happening on the ground from community to community. And the communities that are largely affected are communities of color, because they don't have the same access to the interventions to reduce the potential for having been exposed or having the consequences of addiction.
And Dr. Brown, this really is insidious, because we've seen several stories where there are kids on social media using Snapchat. They're looking to maybe get Adderall. Instead, they're being sent fentanyl and they are dying. What are you doing at your service center to kind of address this, and what should parents be on the lookout for?
With respect to parents, I think it's the old adage, if you see something, say something, have a conversation, and let's have those conversations begin before you see a problem. Let's talk about the issues in a way that allows it to be a constructive conversation. With respect to programs such as START, for us, it means that we are even more important to be able to provide access, that we have to combine the prevention of transmission of COVID with the fact that it doesn't have the negative unintended consequences of reducing the ability to treat persons with an opioid use disorder. So from the standpoint of employers, for example, well, you didn't ask that question, that's an important part of this society and this part of this question as well. Employers have to begin to have the conversations about, we have these benefits in case you need it for the treatment of your substance use disorder.
All right, Dr. Lawrence, thank you so much for your time and your information this morning. We do appreciate it.
Thank you so much.